Iliopsoas is one of a group of 9 flexor muscles that cross the hip joint. It consists of 3 separate muscles, the psoas minor, the psoas major, and the iliacus. Psoas minor is quite small, often absent, and is thus considered an unimportant member of the group. The origins of psoas major are from the vertebral bodies, transverse processes, and intervertebral discs of T12 through L5. The fibers run inferiorly and pass behind the inguinal ligament. They then wrap around the femoral head to insert onto the lesser trochanter. The origins of iliacus are from the superior 2/3 of the iliac fossa, the internal border of the iliac crest, and the ala of the sacrum. The fibers converge to insert onto the lesser trochanter with the psoas major tendon. The shared tendon is known as the iliopsoas tendon. With the origin fixed, the iliopsoas flexes the femur onto the trunk. With the insertion fixed and acting bilaterally, it flexes the trunk onto the femur. Psoas major is innervated directly by the lumbar plexus, while the iliacus is innervated by the muscular branch of the femoral nerve. The rectus femoris is the anterior member of the muscle group of the anterior thigh, known as the quadriceps femoris. Rectus femoris has 2 tendons. The straight tendon originates from the anterior inferior iliac spine and gives rise to the straight head. The reflected tendon originates from a groove superior to the rim of the acetabulum and gives rise to the reflected head. The fibers run inferiorly to insert onto the superior border of the patella and to the tibial tuberosity via the patellar ligament. The rectus femoris flexes the thigh at the hip and extends the leg at the knee. It is innervated by the femoral. Vastus lateralis is the lateral member of the muscle group of the anterior thigh known as the quadriceps femoris. The origins of vastus lateralis are from the greater trochanter, the intertrochanteric line, and the lateral lip of the linea aspera of the femur. The fibers run inferiorly to insert onto the quadriceps femoris tendon, the superior and lateral borders of the patella, and to the tibial tuberosity via the patellar ligament. The vastus lateralis extends the leg at the knee. It is innervated by the femoral nerve. Vastus medialis is the medial member of the muscle group of the anterior thigh known as the quadriceps femoris. The origins of vastus medialis are from the intertrochanteric line of the anterior-medial femur, from the linea aspera, and the medial supracondylar line of the posterior femur. The fibers run inferiorly to insert onto the quadriceps femoris tendon, the superior and medial borders of the patella, and to the tibial tuberosity via the patellar ligament. The vastus medialis extends the leg at the knee. It is innervated by the femoral nerve. Vastus intermedius is the intermediate and deep member of the muscle group of the anterior thigh known as the quadriceps femoris. The origins of vastus intermedius are from the anterior and lateral surfaces of the shaft of the femur. The fibers run inferiorly to insert onto the deep part of the superior border of the patella and to the tibial tuberosity via the patellar ligament. The vastus intermedius extends the leg at the knee. It is innervated by the femoral nerve. The origin of sartorius is from the anterior superior iliac spine. The fibers run inferiorly and medially to cross the knee joint and insert onto the medial surface of the proximal tibia. Sartorius flexes the hip and knee joints and laterally rotates the hip joint. It is innervated by the femoral nerve. The gluteus maximus is the large fleshy muscle that forms the bulk of the buttock. The origins of gluteus maximus are from the posterior ilium, sacrum, coccyx, and the sacrotuberous ligament. Some deep fibers insert onto the gluteal tuberosity of the femur. However, the majority of the fibers insert onto the iliotibial tract of the fascia lata. The gluteus maximus is the most powerful extensor of the thigh at the hip. It also assists in lateral rotation of the thigh. It is innervated by the inferior gluteal nerve. Biceps femoris is the lateral member of the muscle group located in the posterior thigh, known as the hamstrings. Biceps femoris has two heads, the long head and the short head. The origin of the long head is by a common tendon with a semitendinosus from the superior and medial surfaces of the ischial tuberosity. The origins of the short head are from the lateral lip of the linea aspera and the lateral supracondylar line of the femur. The fibers run inferiorly and laterally to insert primarily onto the lateral surface of the fibular head, but it also inserts on the adjacent surface of the lateral condyle of the tibia. Both heads of the biceps femoris flex the leg at the knee and laterally rotate the knee. The long head also extends the thigh at the hip. The long head is innervated by the tibial nerve. The short head is innervated by the common fibular nerve. Semitendinosus lies posterior to semimembranosus and is the most superficial member of the muscle group, located in the posterior thigh, known as the hamstrings. The origins of semitendinosus are by a common tendon with the long head of the biceps femoris from the superior and lateral surfaces of the ischial tuberosity. The fibers run inferiorly to insert onto the medial surface of the proximal tibia. Semitendinosus extends the thigh at the hip and flexes the leg at the knee. It also medially rotates the knee during flexion. Semitendinosus is innervated by the tibial nerve. Semimembranosus is the medial member of the muscle group located in the posterior thigh, known as the hamstrings. The origins of semimembranosus are from the superior and lateral surfaces of the ischial tuberosity. The fibers run inferiorly to insert onto the posterior surface of the medial condyle of the tibia. Semimembranosus extends the thigh at the hip and flexes the leg at the knee. It also medially rotates the knee during flexion. Semimembranosus is innervated by the tibial nerve. The origins of tibialis anterior are from the lateral condyle of the tibia, the shaft of the lateral tibia, and the interosseous membrane. The insertion is to the medial and plantar surfaces of the medial cuneiform and the base of metatarsal 1. Tibialis anterior dorsiflexes the foot at the ankle and assists in inversion of the foot. It is innervated by the deep fibular nerve. The origins of extensor digitorum longus are from the lateral condyle of the tibia, the proximal 3/4 of the anterior surface of the fibula, and the interosseous membrane. The fibers run inferiorly to divide into 4 tendons that insert onto digits 2 through 5. Extensor digitorum longus extends the metatarsophalangeal joints of digits 2 through 5. It assists in extension of the interphalangeal joints of digits 2 through 5. It also assists in dorsiflexion of the foot. It is innervated by the deep fibular nerve. Soleus is located in the posterior compartment of the leg, deep to gastrocnemius. The origins of soleus are from the proximal 1/3 of the posterior fibula and the soleal line of the posterior tibia. Soleus passes inferiorly and merges with the deep layer of the calcaneal tendon, which inserts onto the posterior calcaneus. Soleus plantar flexes the foot at the ankle. It is innervated by the tibial nerve. Gastrocnemius is the large superficial muscle occupying the posterior compartment of the leg. Gastrocnemius has 2 heads, the medial head and the lateral head. The origin of the medial head is from the posterior femur, superior to the medial condyle. The origins of the lateral head are from the lateral condyle and the posterior surface of the femur. As they pass inferiorly, the 2 heads converge and give rise to the calcaneal tendon, which inserts onto the posterior calcaneus. Gastrocnemius plantar flexes the foot at the ankle and assists in flexion of the leg at the knee. It is innervated by the tibial nerve.